Good morning, and thank you for joining me. My name is Jenifer. I am a nurse here at Skin Tonic, and we're just going to talk a little bit about how to prepare best for neurotoxins, or better known as Botox. Things that we want to know ahead of time. Most places are going to require you to fill out a medical history form. Those things have to be on file as well as the consent, so make sure that you do read through those. Things that would be contraindicated for neurotoxins. Obviously, unfortunately, if you're pregnant or nursing, there's not a lot of aesthetic things that we're going to be able to do for you. So that would be a contraindication for neurotoxins, as well as any type of medical history with nerve type damage, myasthenia gravis, and then obviously an allergy to any of the components or ingredients in any of the neurotoxins. As far as neurotoxins, there's several on the market today. Everyone is very aware of Botox. Botox is botulinum toxin A. You also have Jeuveau, which is the same molecular structure. Tends to set in just a couple of days faster, still the full 10 days to full duration. But it tends to be just a little softer, not quite of a vice grip feeling. Then you have Xeomin, which is a generic form. That's great for baby Botoxers, people that have been on regular Botox for several years and just need to kind of switch it up a little bit. There's also Dysport. My practice, I usually reserve Dysport for a female with really strong forehead muscles, or by and large, I use Dysport with men. And then lastly, we have Daxxify. Daxxify is kind of the new kid on the block. It is a longer acting neurotoxin, so maybe not the first thing I would use on someone that's never had Botox. But if we kind of are familiar with your face and how it reacts to neurotoxins, Daxxify is a great choice for getting more like 4, 5, 5.5 months out of your toxin. So if you have a busy schedule, that's a great choice for you. Daxxify also has a peptide in it that the other toxins do not, which is also hydrophilic to the skin, meaning it's going to give you a nice hydrated appearance. And what I've been seeing with the results, nice glassy look, really looks beautiful. How to prepare best for your neurotoxin appointment. It really is helpful if you come with a clean face. Most places will have cleansers and cloths for you. Here at Skin and Tonic, you can go into the restroom and there are some face washes as well as some disposable face cloths. So if you can kind of wash that makeup off prior to the appointment, that'll kind of expedite things. Okay. No alcohol 24 hours before the injections. This is just going to reduce your chance of bruising. Refraining from Motrin, aspirin, or any other type of blood thinners for at least 3 days, preferably 7 prior to injections. If you are prescribed aspirin or any blood thinners by your provider, you're going to want to speak with them before stopping any of those medications, okay? Other over-the-counter things, ginkgo biloba and other natural supplements. Sometimes people forget to consider these, but some of those are also agents that can thin your blood and increase risk of bruising. So we do want to make sure that you let your injector know what those supplements are. Okay. What to expect the day of. Pretty easy. Your provider will go over your medical history, confirm any possible contraindications, get some clarifications, and then generally they'll cleanse your face. Usually alcohol as well prior to injection. Some injectors mark the areas, some do not. I like to kind of explain to my clients why the muscles are moving in certain directions and why we would inject here or not inject here. I'm very transparent. If I don't think that it's the best idea for you to inject a certain area that maybe you're not going to achieve the goal that you're looking for, sometimes it's more of a laxity issue, and there's other modalities that we